Now the disease condition of the pleural effusion. So pleural effusion, also called water on the lungs, is an excessive buildup of the fluid in the space between the lungs. So we all know that fluid is normally reside in the pleural space and act as a lubricant for the pleural membrane to slide across one another when we breathe. So fluid is constantly being added and reabsorbed by the capillaries and lymph vessels in the pleura. And when the recycling process is interrupted, a pleural effusion can result. So, according to the definition, it is a collection of fluid in the pleural space of the lungs. It is the most common manifestation of pleural disease, and etiology range in spectrum of cardiopulmonary pulmonary disorder and or systemic condition to malignancy. Approximately 1.5 million pleural effusions are diagnosed in the whole India each year. Now, so you can see the picture of pleural effusion, like the fluid buildup between the lungs and the chest wall in here. In here, you can see the fluid between the lungs and the chest wall. Now, the types of now the types of pleural effusion. According to the pathophysiology, there are transudative and exudative. So transudative, it's a pleural effusion fluid is similar to the fluid normally have in our pleural space. It forms liquid leaking across normal pleura. This type rarely need to be drained unless it's very large. Congestive heart failure is the common cause of this type, and the exudative is this forms extra liquid protein, blood, inflammatory cell, or sometimes bacteria that leak across damaged blood vessels into the pleura. These type may need to get it drained depending on its size and how much inflammation there is. The cause of this type includes pneumonia and lung cancer. And according to the origin of fluid, the serous fluid, blood, and chyle. So the serous fluid, also known as hydrothorax, it is a type where fluid accumulates in the pleura space from the serous fluid. And the blood, also known as hemothorax, it is a type where the blood accumulates in the pleural cavity. Chylothorax, it is a type where the digestive fluid gets accumulated in the pleural cavity. Now the causes of pleural effusion. The pleura creates too much fluid when it's irritated, inflamed, or infected. This fluid accumulates in the chest cavity outside the lung, causing the pleural effusion. So a wide range of things can cause pleural effusion. Some of the common causes are cancer. Usually the lung cancer is a problem, but other cancer also that have spread to the lungs or pleura can cause too. Infection such as pneumonia or tuberculosis can lead to pleural effusion, and then autoimmune conditions such as rheumatoid arthritis diseases, it can also cause pleural effusion. And then pulmonary embolism, this is a blockage in an artery in one of the lungs and can lead to pleural effusion. And then due to medical or surgical interventions, which includes coronary artery bypass surgery, radiation therapy, liver or lung transplant. Other conditions such as congested heart failure, liver cirrhosis, nephrotic syndrome, pulmonary infarction, and pancreatitis. Now for the pathophysiology,